Hi, my name is Jacqueline Gerby. For my evidence-based practice project, I researched non-pharmacological interventions for pain management in cancer patients. The purpose of this project is to improve pain control in oncology patients on 11 South by using evidence-based practice to create a protocol and implement a pain management bundle using non-pharmacological interventions at Montefiore Medical Center, which is located in the Bronx, New York. The goal is to have a 50% increase in the number of patients reporting adequate pain relief based on their own acceptable pain rating by December 31st, 2018. This problem arose because a majority of cancer patients are experiencing pain on a daily basis. Specifically, 64 to 70% report experiencing pain. However, treatment of cancer pain has shown to be inadequate. The Institute of Medicine reported that chronic pain treatment is frequently solely pharmacological and excludes evidence-based non-pharmacological pain treatment modalities, leading to unsafe and ineffective pain management techniques. Because pain is unique, it has components that are not only related to biological factors, but psychological, social, and spiritual factors as well. For this reason, non-pharmacological interventions can help to manage symptoms of general stress, such as fear, anxiety, and depression, and lead to better pain control. It is recommended that if patients report their pain score as a 4 or above on a scale of 1 to 10, then other interventions, such as the use of music therapy, yoga, cognitive behavioral therapy, TENS therapy should be used to help manage pain. Currently at Montefiore Medical Center, pharmacological interventions such as morphine, Dilaudid, and fentanyl are being used around the clock to manage cancer pain, as well as needed medications to manage breakthrough pain. The goal is to explore research and find the best evidence-based practice to suggest non-pharmacological interventions for cancer pain management. For the clinical question, the population is adult oncology patients on 11 South with chronic cancer pain. The intervention is the incorporation of non-pharmacological interventions for pain control, which will be compared to pain relief with strictly pharmacological interventions such as opioids and narcotics. The outcome is to increase pain management as self-reported by patients using a pain scale of 1 to 10. The PICO question is, are non-pharmacological pain management interventions able to successfully improve pain scores in oncology patients? The search process included databases such as CINAHL, Medline, and Nursing Reference Center Plus. Keywords used for the search were non-pharmacological pain management, cancer, CAM, and alternative pain management. The inclusion criteria included articles from the past 5 years, so from 2013 to 2018, and excluded a level of evidence greater than 3. Data was extracted based on the 6 articles found to be most applicable to the PICO question. Based on the evidence from the articles, it can be concluded that non-pharmacological interventions can be integrated into pain management for oncology patients in an effective and cost-efficient way. So cancer pain can be related to the disease, its progression, its treatment, and processes unrelated to cancer. So while pharmacological interventions may provide quick relief from pain, there's often adverse effects such as constipation, sedation, and medication tolerance. The use of non-pharmacological interventions offers an opportunity to be used alongside of these medications to help patients with self-management and even help patients achieve a sense of control when dealing with pain. It must be noted that multiple reviews suggested that further studies were necessary to prove that these interventions were effective. However, the following recommendations based on the search history include the use of music and poetry channels to be offered in each patient's rooms, the use of transcutaneous electrical nerve stimulation, or TENS, for cancer pain that is unresponsive to conservative medical therapy to manage refractory chronic pain. This includes chronic musculoskeletal pain and neuropathic pain. The guidelines recommend the use of TENS for 30 days. Other recommendations include the incorporation of massage therapy into pain treatment. This has been shown to help distract patients, relax, and bring pain relief from suffering. Lastly, psychoeducation, including nurse-led education sessions and cognitive behavioral therapy as interventions for cancer pain. Cognitive behavioral therapy involves pain education, training in one or more coping skills to manage pain, and helping patients to develop skills for coping with pain. Here we can see the table of evidence that shows the 6 articles that were used. 5 out of 6 of these articles were systemic reviews that showed non-pharmacological interventions from previous studies. The one original study involved in music and poetry for oncologic pain relief. The results of this study showed a significant reduction in pain and depression scores with music and poetry therapy. The systemic reviews covered various interventions such as massage therapy, TENS, acupuncture, aromatherapy, and psychoeducational intervention. Although many of the articles showed that non-pharmacological interventions had a promising future, many of them noted that more studies would be needed to be done to determine the exact effectiveness of interventions. The Institutional Review Board, or IRB, would have to be involved if Montefiore Medical Center chose to conduct further clinical trials to determine if non-pharmacological interventions were appropriate. This is because the studies would include human subjects, and the IRB would need to review the informed consent of the subjects to protect the rights and welfare of the individuals participating in studies. At Montefiore, this would include contacting the Office of Clinical Trials, or OCT, to help with conducting the clinical trials. The Einstein Human Research Protection Program, or the HRPP, would also be contacted to aid in protecting the rights of human research participants. The Iowa method of evidence-based practice will be used to implement this protocol at Montefiore Medical Center. The Iowa model is a systemic method to help organizations utilize evidence-based practice. Using a series of questions, they determine if the topic of change is appropriate for the organization. These questions include whether or not the topic is a priority for this particular organization, if there is enough research on the topic, and if the proposed change is appropriate for adoption. Once the proposed change is approved, PDSA cycles can be used to evaluate the effectiveness on the unit, starting with a small group of patients and increasing the population size based on the success of the interventions. Although the population of interest is oncology patients on 11 South, these interventions can eventually be implemented hospital-wide to help manage pain. An interdisciplinary team consisting of the unit manager, primary registered nurse, massage therapist, and physicians will be used to help implement non-pharmacological interventions on the unit. Interventions must first be introduced to the staff via in-service educational sessions. The evidence behind the various interventions, urging staff to encourage the use of non-pharmacological interventions alongside pharmacological interventions will be emphasized. The unit manager will be responsible for gathering data from patients on how well they perceive their pain control to be. Data will be collected and posted on a monthly basis to show the results to the rest of the staff. It will be the primary registered nurse responsibility to educate patients on interventions, especially the music and poetry channel, which will be available to all patients to use in their rooms. Physicians also must be encouraged to order the therapies, including TENS, massage, and cognitive behavioral therapy as appropriate. The majority of the costs for implementing this protocol will include the addition of staff members such as licensed massage therapists and clinical nurse specialists for cognitive behavioral therapy. Costs will also include tables for massage therapy and TENS machine. The implementation of music and poetry will be at little to no cost for the hospital, with just the addition of a music and poetry channel to the televisions that are already in patients' rooms. Because pain is subjective, self-reported pain levels based on a numeric scale will be used. The numeric rating scale is recognized by the American Board of Family Medicine and the Institute of Medicine as a reliable tool for pain screening. Pain scales will be assessed to evaluate trends over the course of the following months. Patient will also be asked how often was your pain well controlled prior to discharge. The goal is to increase the percentage of patients reporting always by 50% by December 31st, 2018. In addition to evaluating if the interventions are effective, it must also be evaluated if the specific interventions are cost-effective for the hospital. It has been suggested that an improvement in a patient's overall pain management score will cause an increase in patient satisfaction scores on the HCAHPS, or the Hospital Consumers Assessment of Healthcare Providers and Systems. For Montefiore Medical Center, an increase in HCAHPS scores is important because 80% or more of patients are Medicare and Medicaid patients, and this is what we rely on for reimbursement. The 2012 Center for Medicaid and Medicare's Pay for Performance indicates initiatives for higher patient satisfaction scores. So if a patient's pain is more well controlled, the patient should have a higher satisfaction score, leading to an increase in reimbursement. It will be the responsibility of the unit manager to maintain scores for pain management and post them on the bulletin board for staff members to see. These scores will be posted along with HCAHPS to encourage the continuation of non-pharmacological interventions. It will be the nurse's responsibility to educate the patients on pain control and pass out pain cards on admission, which will include informative resources to tell the patient a little bit about pain, how the number scale works, and various interventions for pain. Due to the increase in reimbursement that Montefiore Medical Center should see after the incorporation of non-pharmacological pain interventions, it should increase management's incentive to enforce the use of these interventions throughout the unit and hopefully hospital-wide.